The AstraZeneca Healthcare Foundation founded the Connections for Cardiovascular Health in order to make an impact on cardiovascular health, because we know that cardiovascular disease is the #1 cause of death in the United States.
We're giving these organizations important funding to implement efforts that would work at the community level.
We have long known that grassroots advocacy has been an impetus for social change, which is why it's important to support these community level programs.
These are really good people doing the hard work in our society.
And we're seeing that it actually works.
Over 1.6 million people have come through these programs that we've funded. 56,000 people have been tracked, and we've really seen a big difference. All of you that are here today and the organizations that you represent truly embody the spirit of what we'd always hoped the Connections for Cardiovascular Health would bring.
Well, frankly, the funding is saving lives.
We're able to partner with other community providers and get outside of our own walls and reach people who are really falling through the gaps.
We're working with schools we've never worked with before, clinics we've never partnered with before.
Es un programa que hacemos con el corazón. Es un programa que hacemos con amor. Eso es un programa de vida.
It has helped us to get more training and also how to provide the tool and the education that they need in order to improve their health.
We don't do it because we don't understand yet. And I'm glad you people are out there teaching us how to understand.
One week we may be talking about their numbers. The second week we may be talking about food labels.
The program, it gave me my life back.
Most of these deaths are preventable. About 70 to 80% are preventable. So now what more motivation do we need?
We believe at the foundation that given these huge challenges, the way to begin to address them was through community-based organizations like yours.
Making this impact, the fact that we're also then able to share these lessons learned is just a tremendous thing that we're able to accomplish.
Certainly sharing the important lessons learned, we feel will help other programs along the way. There may be pearls that one program picks up from another program that may help improve their efforts within their community.
We have done very well, and we've done well because of you all.
I would say one of the lessons that we've learned is don't go at this alone. It takes a group, it takes partnership, it takes community.
Education really is the key. There's a lot of unlearning that needs to be done.
One of the key things you want to keep in mind is not just bringing health professionals to the table, but bringing your participants in as well. We learned a number of things that we wouldn't have come up with ourselves. And some of those patients who came up with those ideas are most engaged and have seen the most change so far.
By the time I completed with the program, I was ecstatic.
I was at a point that wasn't good, and they brought me back to where I wanted, and that's what I needed to keep going. Thank you.
We've been able to see a significant improvement in our patients.
They've lowered their blood pressure, they've lowered their A1Cs, they've decreased their BMIs, they feel better, they have more energy. It all ties back to the heart.
They said this program gave us ownership of our health.
When you have healthy parents that are able to take care of their children, they are able to continue to provide to the community.
It's exciting to see that people are gaining the tools that they need to make these choices on their own after the program ends.
Now at the end of 7 years, we have been able to come up with sort of best practices.
The bar is quite high to receive a grant, so for participating organizations to come in for second, third grant, it means they're really doing something right.
And we expect them to go back and to hit their marks, to drive real change, and then more importantly, to come back and share with us what they've learned so that we can help other organizations that are on their journey also improve their mission.